It's my pleasure now to introduce Amy Rosenthal, who I've known for a very long time in many different capacities. She is an extraordinary advocate, has an extraordinary political sense, which I totally lack, and working at Community Catalyst, she and the team there have just been unbelievable in the past couple of months in terms of doing both the analysis to share with us at the state level in terms of data, but also in terms of strategies. And we're very lucky in Rhode Island that our federal delegation is our leaders in terms of preserving the Affordable Care Act. So we haven't needed a lot of hand-holding on that, but even with that, all the information has been terrific. And they have been doing tremendous work with our colleagues in other states who have been trying to stem the tide of bad things happening. So it's my pleasure to introduce Amy.
It's a really interesting day to be here. There's a lot of activity happening on the national front. So when I first started at Community Catalyst 11 years ago, Rhode Island became a very important partner to the work I was doing with the Children's Healthcare Project that I was running. So I have deep affection for this state and all the work that you do. So it's fitting that I guess I'm here today. So in terms of our agenda, we're going to talk a little bit about what's at stake, briefly on the new political environment. I'm going to tell you about the American Health Care Act and what it means, and the role of activism and kind of where I see things going. In theory, I've never had dates, slides get so out of date in 24 hours as these have. So we're going to wing it a little bit and we'll just take it from here. So a little bit about my organization. Linda told you a little bit about it. Community Catalyst is a national healthcare advocacy organization. We're based in Boston. We have about 75 staff. We have offices now in Atlanta, Pittsburgh, St. Louis, Missouri, Washington, D.C., and a couple of other places. I think Michigan just opened. We work in about 40 states across the country. We run both issue campaigns, and we also work to provide technical assistance to groups across the country who are working on making sure that the consumer voice is heard in healthcare and advocacy. We also have a national presence. That is the role that I play. I have spent most Tuesdays over the past 8 years on a plane back and forth to Washington, D.C. I think my kids totaled that it was 150 trips that I had done to work on the healthcare law, and so I have a lot of incentive to try to see this thing continue. Besides the whole fact that we want all these people to have health insurance. So Linda talked a little bit about the AHCA. I think one of the things that we always say is that it's not perfect. We recognize that there's a lot of issues. For people in this room, you probably care about some of the affordability issues just like we do. But it does a lot of good things. And Linda talked about some of those. We've seen the number of uninsured nationally get cut in half. This is obviously a huge, huge, important expansion. It's the largest expansion we've seen since Medicare and Medicaid. Medicaid expansion played a huge role in doing this. Walking you back through this timeline, some important key points to remember. So the bill was signed into law in 2010. Consumers were able to start enrolling in 2013. 2014 is where we saw Medicaid expansions begin and a lot of these insurance reforms that Linda talked about kick in. And through all of this, there's been efforts to repeal it. Like what we're experiencing today is nothing new. You all know that. I forgot the insane number of times that Congress has voted to repeal this thing. In 2015, it did make it to the president's desk, and he did veto it. And by 2016, we know that 20 million individuals have received coverage through the law. So then this happened. It was not what any of us were probably expecting in this part of the country, but it is the reality in which we live. And we talk about this all the time at Community Catalyst, that we are going to move forward and plug ahead regardless of what our environment is. But unfortunately, I think this environment is a somewhat toxic mix as it relates to healthcare. So just a little background. As we all know, that our current president ran on a campaign that disparaged women, immigrants, people with disabilities, and members of the LGBTQ community. And at the same time, on the campaign trail, he made promises that he was not going to cut entitlements, Social Security, Medicare, and Medicaid. In fact, he said he would save them from cuts. But unfortunately, we all know about this alternate facts world in which we live in, and we have not been able to take him at his word. And despite the fact that even up until yesterday, he's saying that the bill at hand is not doing some of the things that is protecting people. It's important that we stay grounded in the facts and the truth of what we know is going to happen potentially in this bill, but also what we're going to see down the pipe. And we need to kind of stay grounded in the type of work that's done here and make sure that we really understand the issues. Tom Price in the bottom right is the new Secretary of Health and Human Services. He is an orthopedic surgeon from Georgia. A little history about his record in the House. He served for 6 terms. He sponsored legislation that supported making armor-piercing bullets more accessible. He opposed the regulation of cigars and voted against regulating tobacco as a drug. He was one of only 47 representatives to vote against the Mental Health Parity and Addiction Equity Act. He voted against funding for combating AIDS, malaria, and tuberculosis, and he voted against the expansion of the Children's Health Insurance Bill. So, again, we believe that we need to go in fully understanding the environment in which we work. And this is the environment now. It's a very different environment in the way HHS was being run for the past 8 years. Mitch McConnell, in the bottom left, is the leader of the Senate. He has been wanting to repeal the AHCA since the day it was passed. And Speaker Ryan in the top left, probably all of you saw his famous quote about the days he was drinking from a keg in college and dreaming of dismantling Medicaid. So, this is the party that we are at. And we need to understand it and we need to know what we're dealing with so that we can be smart about it. So let's pivot to kind of where we are right now. So, the American Health Care Act. A brief overview. So it takes away a lot of the things that are in the Affordable Care Act. So it eliminates the individual and employer mandates. These are the mandates that enable the risk pool to be healthy by having people who are not sick at the moment to be part of the risk pool so that insurance can work the way it's supposed to work. The subsidies that Linda talked about, it reduces those by about half. And the way in which they structure it is that rather than focusing on your income and giving you subsidies as it relates to your income, it focuses more on age. Now, there's some benefit, you could argue, to making sure that older people who have more illness are having greater subsidies, but at the same time, we all know that low-income people are across the gamut in terms of age, and that those are the people that we need to make sure are having subsidies. It also repeals virtually all of the taxes that are in the Affordable Care Act that are used to pay for the bill, the law. And so this is problematic. Everything from the device tax to the tanning salon tax, they're all repealed except for one, which is just delayed by 8 years. Another thing that's not on this slide is the age rating, the ability for insurers to charge the difference between what they would charge a young healthy person and an older sick person. In the Affordable Care Act, that difference can't be more than 3 to 1. This expands it to 5 to 1. So, there's a lot of things in here that are not very good. So it also does a lot to Medicaid, and for my organization and many, that this is, I wouldn't say worse, but maybe I would say worse. It's really bad. It ends the enhanced match that Linda talked about that you get for the Medicaid expansion, and that will happen in 2020. Rhode Island is very fortunate that it did expand Medicaid, as did many states, but there are 19 states out there, many states in which Community Catalyst does a lot of work, where the expansion has not happened. Places like Port Kansas came really close just a few months ago, and this takes us off the table for them. It also converts Medicaid from the structure that Linda talked about, where it's an open-ended matching structure and states get a certain amount of dollars for every person that they have covered through Medicaid, to a per capita cap or a block grant. And this is a fundamental switch in the way that Medicaid works. And this has tremendous long-term effects. So in a per capita cap, the state would get a certain amount per individual enrolled. In a block grant, they kind of get a big chunk of money based on a variety of different historical factors and trend rates. There are some people across the country that say, well, that maybe isn't so bad. Maybe our state can get a whole bunch of money and then we can use it really wisely, and we can figure out how to do some cost-saving measures and some delivery system reform and things like that. But the problem is that when you cut $880 billion from the program, it's not actually going to work that way. There is, I lost my notes. The reason that the federal government wants to block grant or do per capita cap is it helps the feds have a greater budget certainty and reduces overall spending. And that's the key that I think people need to remember, is that they're doing this because they want to reduce the amount of money spent on entitlements. They'll base the amount of money that states get on some historical data. And in Rhode Island, you're very fortunate that you're like the third top state in terms of getting money per capita for the amount of money that's coming from the feds. And while that's good for you now, and you can say, okay, well, if they're basing it on historical data, that's where we're going to start, and that's how much money we're going to get. But believe me, over time, they're looking to kind of even the playing field. And so states that get a lot of money now are probably going to see very significant cuts. And that's where it becomes particularly dangerous for a state like Rhode Island. We know that when they have to do cuts like this, states are put in a very difficult position, right? The money's not coming in from the feds, and so what are your options? You can cut eligibility or benefits, you can increase cost sharing, you can decrease provider payments. In the case of block grants, you can establish wait lists. None of these are things that I think people in this room are really interested in doing. And so this piece in particular becomes very dangerous. So, that's the heavy news. I know it's not really fun to deliver all of that. But let me tell you some good stuff. So in round one, they did not get this done. The plan originally was that Trump wanted this on his desk on Inauguration Day so that they could fulfill a campaign promise that he'd been making, and that frankly, the House and Senate Republicans had been promising to do if they ever gained control. So Inauguration Day came and went, and they did not have this done. They did not have a plan. And one of the first most important things that the group that I work with, which is called Protect Our Care, and I know that that's kind of a national version of what you have here in Rhode Island. Protect Our Care nationally is made up of about 300 national organizations. Community Callus was one of the founders of it, and we're on the steering committee. One of the best decisions that I think all of us made was to change the debate from just simply we can't repeal the Affordable Care Act to they need to repeal and replace it, because they didn't have a replacement plan. And that was one of the big helps. And one of the things we knew is that the more time that we could buy in making this stretch out for as long as possible to give, frankly, the people in the states the opportunity to weigh in with their members, the more successful we were going to be. So one of the pivotal moments, I would argue, in this debate was around changing the dynamic, changing the frame from simply don't repeal to repeal and replace. So that was kind of point number one, and that kind of bought us through Inauguration Day. The next big moment was they wanted on President's Day, February 20th, so a month later. And again, they couldn't come around together to come up with a plan that would both appease the Freedom Caucus, which is the most conservative Tea Party group of the Republican caucus, and the Tuesday group, which is the more moderate groups that are within the caucus. So that has been their challenge all along. So people may remember in March that they were supposed to put on the floor. Paul Ryan came out, he had a press conference, said that this was not something that they had the votes for. It went away. We had April recess. There was tons of activity across the country telling people that this was a very bad thing. And then the 100-day mark hit. And, you know, if nothing else, our new president is into kind of symbolic moments. And so I think the 100-day mark really kind of stuck with him, that he had not fulfilled this promise. And I think that that is, in part, what prompted this new round of debate to happen. So, yay, big victory. but now it's back. So now we have the zombie American Health Care Act. So it's the original bill, but it's worse. Particularly because I want to focus on two things. So number one, the pre-existing conditions. It gives states an option to have a waiver to kind of no longer cover people with they'll still have to cover people with pre-existing conditions, but they can basically charge them whatever they want. That takes us back to days where, like, you're going to say a $25,000 increase in your insurance costs if you have heart disease or whatever it is. So yes, maybe technically on paper they are saying that they're covering pre-existing conditions, but in practice they are absolutely not. And this is something that the GOP has promised again and again that they would not take apart. And so this is a really big deal. The second thing that's in this amendment, the MacArthur Amendment, is that the states no longer have to offer all of the benefits in the essential health benefits package. So they don't have to cover maternity care, they don't have to cover substance use disorder treatment, they don't have to cover things that they frankly don't want to be covering. And that is also clearly a major setback. The good news is that up until Wednesday, we had secured the 23 Republican votes that we needed in order to stop this bill dead in its tracks. I actually think on Tuesday night we had our whip count showed us that we were at 30, and possibly even more than that. So that was really good. On Wednesday morning, Congressman Upton from Michigan, who for many years led the kind of key healthcare committee in the House, went to the White House with a congressman from Missouri, and they struck a deal with Trump that they were going to add an additional $8 billion into the high-risk pool. So when people with pre-existing conditions basically can't afford their coverage now because of these provisions, they're going to make a high-risk pool available only for states that actually take the actual waiver and get rid of that provision in the law. And they're going to add in, I think it's $8 billion, I can't remember if it's over 5 years or 10 years. 5 years, thank you. And let me tell you, $8 billion over 5 years is like nothing. So that high-risk pool is so grossly underfunded that some of the best estimates say that they need to invest an additional $20 billion a year in order to make it whole to serve the needs of people with pre-existing conditions. Unfortunately, this kind of symbolic token went a long way. And with Upton, they're saying he carries at least 8 votes with him. And last night, the House, this is where your slides no longer apply. You're getting up to the date information. Last night at 5 o'clock, the House leadership met. They felt that they had secured the votes. They sent it to the Rules Committee, which is the first step that they need to take in the House in order to move this bill along. Overnight, they worked on twisting a lot of arms. I'm pretty confident that every Republican on our whip list was getting significant amounts of pressure from leadership in the White House throughout the evening. We're expecting a vote in, 1 hour, possibly 2. I know that calls until the last possible second matter. I'm remembering my days of doing CHIP reauthorization with Linda and Jill and others in the room. And our partners in Connecticut, this is my favorite story to tell. Chris Shays was a Republican congressman from Connecticut at the time that we were trying to reauthorize CHIP back in 2008, 9, 7, something like that. And he was undecided until the very last minute, and we were pounding him with phone calls. And literally an hour before the vote, he called our friends at the Children's Hospital and said, okay, tell the phone calls to stop, I'm going to vote for the bill. So there's always hope, and that is what we're doing today. The phones are activated across the country where we have targeted members. Again, I think Linda mentioned that you're very fortunate, you have a wonderful delegation, and I'll talk about that in 1 second, but there are some other folks across the country who are not in the same situation. I've never been so proud of state-based advocates as I have been over the past 4 months because they have been relentless. The stamina from the folks in Pennsylvania and Tennessee and Ohio and Arizona, I mean, these folks have been week after week planning events and trying to reach these people. So you can feel good that while I know you guys are doing absolutely everything you can do here, you have people across the country in these target zones who are also doing everything that they possibly can. Actually, I'll do this now, and then I'll come back. So that gets me to this concept of activism, which, there were a lot of reasons why they said the bill failed in March, and whether or not we actually defeat this thing today or not, there are huge lessons as it relates to activism from what has happened over the past 4 months. So first of all, people often say that healthcare is one of those issues that affects a lot of people, but people don't kind of get all mobilized and excited about it. I mean, we have completely proven that to be wrong over the past 5 months. We have seen an outpour like we have never seen before. And this is really important. And one of the things that we talk about a lot, and it's my favorite thing actually to talk about right now, is this continuum. And it takes all kinds of people in order to have the impact that we have had over the past few months. And when I think of a continuum, yes, it would be on the far left side, because I'll put us on the left side because of where this all sits. You have your kind of hardcore grassroots activists, the folks that are doing kind of civil disobedience, they're holding die-ins, they're really pushing the limit, they're generating great press because they are doing things that are seen as more extreme. SEIU organized this civil disobedience, everyone get arrested inside the Senate buildings a couple of weeks ago, or I guess it was a couple months ago now. That was really important in this effort. Right, so that is really important. At the other end of the spectrum, you have your chambers, your insurers, your hospitals. Now, some of those folks may be very vocal. They may be part of your coalitions, they may be issuing press releases all the time, but some of them, for whatever reason, may choose to want to be a little bit more quiet in how they're dealing and addressing their activism. And so a lot of times you'll see people kind of in this middle space, kind of at the far end of the spectrum, but kind of center middle, that they're doing their work behind the scenes, right? So they may be having constant conversations. I know a lot of insurers who were not being very public, but were at Capitol Hill and in district offices having conversations all of the time. And then there's kind of like everything that falls in the middle, right? So it's like the rallies and the phone banks and the reports that are written, and all of that matters. And I think that one of the things that I'm hoping the healthcare community has learned through this process is to appreciate and respect where everybody sits on this spectrum. Because it's the combination of all of it coming together that I think has gotten us to this point. To be perfectly frank, when we first started doing our targeting, the whole story was in the Senate. We never, ever, ever dreamed that we were going to stop this thing in the House. In fact, my organization will probably put about $5 million into this fight, and we were spending virtually all of our money in the Senate. And then things shifted because the pressure and the intensity of the activism that was happening in the Senate was so strong that I think it carried over to the House. And shame on us for actually abandoning the House and not thinking about them earlier. So the fact that we're here today and we're on the cusp of this vote, which may not go our way, we will live another fight to fight this in the Senate. And I do believe, and I just hope everybody thinks about this continuum, that we need to be respectful and we need to be appreciative of kind of everything along the spectrum. I know I touched on this before, but I do want to say thank you. I know that you all have done tremendous work here in terms of engaging your delegation. A long, long time ago, as someone from Massachusetts, Senator Kennedy once said to me, sometimes the progressives are really, really bad at forgetting to talk to the progressives who are elected officials. And I think that you all have done a really good job of making sure that your elected officials who don't need to be persuaded and are champions on this are hearing from you, and so kudos to you for not letting that ball drop. I know you're also doing a lot of base building, which is incredibly important. You're collecting stories. On the national level, we've had these bus tours, rallies, et cetera, et cetera. So I don't have a slide for what I'm about to talk about. So in my last few minutes, I guess I want to tell you kind of what happens from here. Actually, you know what I'm going to do? What happens from here? So I'm going to get a little technical with you for a second, but I think it's going to be helpful because if this moves over to the Senate, I think it's kind of an important thing for people to understand. So if the House will vote midday today, if it passes, it's going to move over to the Senate, and the Senate is going to follow procedures in ways that are a little bit different from what is the normal. So first of all, they're not going to, usually a bill would then go over to the Senate, it would go to a committee, where the committee would either make decisions about what's coming over from the House and would, think about what it is. They're going to skip the committee process. So this bill is going to go directly to the Senate floor. Senator Alexander from Tennessee is going to play point on this for a whole host of reasons. He will be the point person on it. And they're going to use a process called budget reconciliation. I guess show of hands, has anyone ever even heard of budget reconciliation before? Okay, awesome. Does anyone here actually feel like they understand what budget reconciliation is? So I'm going to tell you what it is because I find it really annoying that the press talks about it all the time and no one has any idea. So I'm going to try to simplify it in my last 5 minutes so you understand. In the House, if you want to pass a bill, it's just done by a majority, right? You have to figure out how many it is, divide it by 2, get an extra person. It passes through the House. In the Senate, ultimately you have to pass a bill by getting a majority vote. But before you can get to the point where you can vote on the bill, you have to take another vote. Now that vote is called cloture. So in the Senate, a bill comes to the floor and all the senators get an opportunity to debate it. Now, in order to stop the debate and move to the point where you can actually vote on the bill, you need cloture. And in order to get cloture, you need 60 votes. Now, back in the day, when Congress was a civilized place to work, it was customary that each party would give each other the votes for cloture so that you could then move to the point where you could actually vote on things. As things have become more politicized, people no longer want to give each other that vote, and frankly, advocates on the outside are holding our members accountable for voting on cloture because they perceive it as essentially allowing the bill to move to the point where it can get passed. Right or wrong, no judgment cast, that's just kind of the reality of what it is. So this threshold of getting 60 is really challenging. Now you may remember when we passed the Affordable Care Act, for a large part of it, Democrats had 60 votes. And then Senator Kennedy passed away, and my state elected a Republican to fill his seat, and it messed everything up. But right now, the Republicans do not have enough votes for cloture. So there's one way around that, and that's called budget reconciliation. Budget reconciliation is a maneuver or process you can use where they pass budgetary instructions that say, we in the Senate are going to address budget issues in the following way. They lay out a set of instructions. And when you move a budget reconciliation bill, it only needs 50 votes, well, 51 votes to pass. You don't need cloture for a budget reconciliation. But there's a catch. There's 6 criteria, which I'm not going to go into, that actually have to be met in order for the parliamentarian of the Senate to say this passes the muster for budget reconciliation and can get by with just the majority vote. Now, when the bill from the House comes over to the Senate, it's going to go through what they call a bird bath. It's named after Senator Byrd, who was a stickler for the rules of the Senate. And they are going to go through and figure out all the things that don't apply to the budget that cannot be brought up under the Senate budget reconciliation rules. The parliamentarian won't actually pull them, but she will make a determination as to whether or not she thinks they pass muster. When it gets to the floor, the Democrats, I can guarantee, are going to go through every single one of those provisions and vote to try to have it removed from the bill. That's going to shake up the dynamic of the bill. If the Republicans want to add anything into the bill, they also are going to have to make sure that it in some way relates to the budget. So some of these insurance reforms that we really care about, if they can't be tied into the budget in a way that meets the parliamentarians' approval, they won't be able to be included. And so this is the process they're going to go by. And we can't be upset about it because we used the same process to get the law passed. So we did it first, and I like to say that because it's only, when you kind of cut the path and you go down that road, you have to expect that people are going to do the same thing and come back at the same time. So that's the process that will happen. We will see it move over to the Senate. There are some people that think that this could go on for a long time. There are some people that say it will happen within 3 weeks. It's totally, nothing is clear at this point. So the most important thing that all of you can do is continue to engage your members, continue to talk to your senators about not only just being a strong voice on Medicaid and the AHCA, but asking them in caucus meetings to be a strong voice with their peers and asking them to step up. The other thing you can do is, I'm going to give you a list of states. I don't even have this on a slide. And if you have friends and family in these states, you should ask them to call their senators, and you can start at 2 o'clock today. Let's see if I can remember them all. Maine, West Virginia, Tennessee, Alaska, Arizona, Nevada, Pennsylvania, Ohio, Iowa. I did all 9. I usually forget one. It's never the same one, but I always forget one. And so that is a takeaway, because I think there's a lot of times people who have senators who are really engaged and wonderful, they want to do something, and reaching out to friends that you have in those states and asking them to call can make a real difference. So let's see if I have any other slides that are relevant, because I'm out of time. Okay, one last thing I will also tell you is, once we get through this whole legislative mess, there's 2 things we need to look at. So number 1 is the administration will also have the ability to weaken the Affordable Care Act and Medicaid through administrative action. So remember Tom Price and his awesome track record of supporting healthcare issues. He will be able to do a lot, and his team will be able to do a lot administratively. And so there's going to have to be vigilance. I mean, these guys will be great at making sure that they know what's happening and understand how it affects Rhode Island. That will be one way. And then there will be other bills that come down the pike. The CHIP reauthorization, which is coming, budgets that are coming down the pike. And you have to keep your eyes open, because my guess is we could potentially see other cuts to Medicaid and other programs, healthcare programs that we care about. So I would say this is definitely not the most uplifting speech I have ever given in my entire life, and I apologize for that, but I do think it's important to be informed, and hopefully this helped in some small way. So.